So great question. I am a big advocate of mouth taping to train nasal breathing. Now, I always give a caveat here is if someone has some form of airway obstruction, like upper airway resistance syndrome, which is kind of like just think of that as snoring, to sleep apnea, mouth tape can help improve to some degree, but it is not a recommended treatment option, especially for sleep apnea. Like mouth tape for sleep apnea, and you can't like if you get a diagnosis and a prescription, they will never prescribe mouth tape because it's not used to treat sleep apnea. I've never seen any research to really say, hey, this is an effective sleep apnea treatment. EPAP device, on the other hand, has been studied, and if you got a diagnosis and a prescription for sleep apnea and an EPAP device, you can use that to treat various levels of sleep apnea, like mild forms of sleep apnea. So I'm a fan of mouth taping as long as it is not to mask an underlying problem of airway obstruction. I am right on board with you. So my biggest concerns with fluoride is with developing children. An adult that is using fluoridated toothpaste and spitting it out, there are some risk there, but it's like pales in comparison to young children drinking fluoridated water day in and day out, doing high concentration fluoride varnishes, rinses, toothpaste, swallowing this, because the research is, I mean, there is an ever growing body of research showing how this fluoride consumption during development very negatively impacts the brain and is neurotoxic and is almost on par with lead as far as drops in IQ in children in many studies. 5 IQ points it seems to be almost like kind of like the baseline. And to me, the risk of getting some cavities, and we can talk about that as well, pales in comparison to like damaging a brain for lifelong. Like I could fix a cavity in a couple minutes. Like I can't fix that brain. Even the research, like one of the largest studies ever done with regard to this, showed that fluoridated water in particular might reduce the incidence of cavities by one surface cavity. Just to give you a perspective, if there's a surface cavity on a pediatric tooth, I can literally fix that in like 5 minutes. So to me, it's not worth
the risk to the
exactly.
not irreplaceable brain tissue.
Exactly. And there's other risks. Thyroid risk with fluoride, it can compete with iodine for uptake in the thyroid, so it can lead to hypothyroidism. We see communities that have fluoridated water have higher rates of hypothyroidism, kidney issues, bone issues.